Now, there are some 953 people that are in hospital. That's pretty well steady on yesterday. 111 people in ICU, 29 of those are on a ventilator. Sadly, 25 people with COVID-19 have passed away. Of those, 17 passed away in the last 2 days. We send, of course, our very best wishes and our condolences to their families. This will be an incredibly difficult time for them. In terms of case numbers, there were 16,843 Victorians who self-reported their positive rapid antigen test. Thank you so much to them. They, of course, went to coronavirus.vic.gov.au/report. That's the thing to do if you've gone and got a RAT test and you have a positive result as a result of that process. You then go and self-report. You'll be included in our numbers, and then if we need to get care to you, you'll be part of that system, part of that home pathway system, and known to the overall COVID health response as well, which is very important. That's why rapid antigen tests are so critical to this. If you wait for what can be quite lengthy periods of time to get a PCR test just because of the volume, and this is not just in Victoria but in every part of our nation, then you may well be positive. You may well have lost precious days when we can be providing you with the care and support that you need. That self-reporting is very important. Beyond that, a further 20,326 people received a positive PCR result from 62,406 results that came to us yesterday. It gives us a total new number of cases, a new case tally of 37,169, and that takes the total number of active cases across the state that we know of, both through self-reporting rapid antigen tests and laboratory confirmed PCR tests, to 221,726 active cases on those combined measures. Now, you'll all recall earlier in the week, Minister Foley made some announcements in relation to exemptions from the household contact ISO requirements for staff in a number of critical industries. The food production and food distribution sector was our primary focus, as it needed to be. Cabinet have made a number of decisions yesterday afternoon into the evening to add to that list, and I'm very pleased today to be able to announce it. Based on the hard work of our public health team, we are able to add to the list of food and food production, food distribution. We can also add emergency services, education, critical utilities, custodial facilities, transport and freight, so all transport and freight, not just food production or food-related transport and freight. Those sectors will join the food sector in a broad sense. They will be exempt if they're playing a critical role. They will be exempt from having to do home ISO. They will need to take a RAT test for 5 days, and if that is negative, then they can proceed to do that critical work that we need them to do. And that in those circumstances, and given where the pandemic is up to, where we're our broader context, that is a safe setting, and it's critically important that they be playing those key roles in lots of those industries and indeed the food sector more broadly. Jerome will speak a little bit more about how that works in a practical sense and what the obligations for both employers, employees, that whole process. But they're important additions to make sure that whether it's waste or power, gas, all the way through to law enforcement, our prisons, all of those sectors, they need to continue regardless of the fact that we are in a global pandemic and we have this variant of concern, and exempting those workers, not all workers in those businesses, but those workers in those businesses or those sectors that are critical, exempting them from the home isolation requirements is a common sense way in which we can keep those services, those important parts of our economy and important parts of our society as close to normal as possible. In terms of supply chain, just lastly before I ask Jerome to add to my comments, in terms of supply chain, there are many different challenges. I had a meeting with supermarket CEOs yesterday and just gave them a chance to again, reflect on some of the challenges that they're facing coming out of that meeting. There's a whole range of things to follow up. We're in deep and ongoing contact with those, very deep engagement with that sector and so many other sectors. But it was important just to hear firsthand, and not the first time I've done it, but it was important to hear firsthand about the challenges that they're facing. Last week was kind of distribution centres and some real bottlenecks there. This week it's about truck drivers and a shortage of those to move. There's plenty of stock in many different parts of their offering. Challenges with meat and poultry, but a lot of other challenges are not so much about the availability of stock. It's about moving that stock from one part of the state, one part of the country to the other. So we continue to work with them and their unions to try and do whatever we can to ease that pressure. These announcements, both those made on Monday and the fact that we've added to the list today, will support many different businesses in many different sectors to try and balance and try and deal with the challenges that we all face at the moment. There's no quick fix to this, and I say that not just as someone who's announcing changes to rules. I say that as on behalf of the government, as the biggest employer in our state. We are feeling these challenges too. There are at least 5,000, potentially more than that, nurses, doctors and ambos who can't report for duty, despite the fact we've got more and more cases that need care. High demand, but we've got at least 5,000, it may be considerably more, members of our health team that simply can't come to work because of this virus. So we know and understand and are experiencing some of these challenges just as industry and individual businesses are. These are common sense changes. They will help. They're not everything. There's no simple solution other than we need to do as best we can, and we need to get everybody to go and get a booster, and we need to get our kids vaccinated for you, for the people you love, and for the people we all depend upon, our nurses, our doctors, our ambos. This is about protecting capacity in our health system. I again just remind people that it's very good that so few people are becoming gravely unwell when they get this Omicron variant. That's good news. That's the vaccines working. But what they don't prevent is the transmission. As we can see from these case numbers, more than 200,000 active cases, they don't prevent anywhere near as well getting and giving this virus. On that basis though, whilst we haven't got people that are critically ill, we've got nearly 1,000 people who are unwell and need hospital care. They're not in intensive care, but they are still in hospital. And when you've got more people needing to go into hospital and less workers who can provide that care, that's a very significant challenge. To put it another way, I know it's very frustrating to have to isolate at home. It's very frustrating to have to change your movements, your habits, to live differently while you wait for a test result, for instance. I know and understand that is very challenging. There's no family that hasn't been touched by that over the last couple of years, and certainly many that have been touched by that over the last few weeks and months. But if we were to say it's all too hard, let's stop isolating, let's stop getting tested, let's stop acting based on symptoms, then we wouldn't have nearly 1,000 people in hospital beds, ward beds, not ICU beds, ward beds. We wouldn't have 1,000. We'd have many thousands. And that would be very challenging not just for COVID patients, but for, as we've said so many times through these last 2 years, everybody else who needs a hospital bed and can't wait, whether it be a stroke, cancer, a car accident, all sorts of different, a heart attack, all sorts of different reasons. We've got to protect our health system as best we can. But the greatest contribution anyone can make is to follow these rules, to isolate if you've got symptoms, to get that RAT test or to go and get a PCR test where it's appropriate. It's deeply inconvenient, but it makes a massive difference. And the other thing, of course, get your kids vaccinated. There's plenty of appointments there, and get your booster. Your third dose will protect you not just against serious illness, but it will slow the spread of these Omicron cases. 3 doses is much more protective against transmission than what just the 2 doses are. And being fully protected, not just for now, but for the rest of this year. This is very, very important. We are one of the most vaccinated communities in the world, but not if we don't all go and get our booster. 250,000 appointments. Please make one today if you're eligible. It's great that we've gone past the 1 million, but we still have many millions more to do. With those few comments and that announcement, I'll now ask Jerome just to talk a little bit more about testing and some other matters, and then we're happy to take your questions.